Hi, I'm Dr. Ron Miller, and I'm one of the lead sciatica experts here at Pursuit Physiotherapy. And we created this video for you. So if you're watching this, you're probably dealing with some sort of sciatica or radicular leg pain. And we're going to go over actually the three main steps or the three phases that you need to learn to get pain-free again and to get real results and get rid of your sciatica pain. So this video is for you if you're looking for the best sciatica treatment. Sciatica is different, and there's different root causes across the board, and there isn't a cookie cutter standard approach to treating sciatica. You have to solve the root cause of your pain, and we really pride ourselves in treating the root cause and only doing treatments that are proven to work. So we're not going to waste time, and we also believe that we owe it to you to get you pain-free in the fewest amount of sessions. So we're not going to try to extend care and see you 3 times a week for 4 to 8 weeks or get you on an 8-month program to treat your sciatica. If we know that we can get you pain-free in 6 sessions, we're going to get you pain-free in 6 sessions. And our model is built to get you pain-free in the fewest amount of sessions because we only do one-on-one patient care here. We don't double or triple book patients. We don't pass you on to techs or assistants. We make sure that it's one-on-one treatment with the board certified expert, and treatment is customized for your type of sciatica. It's not standardized, and we don't do any cookie cutter approaches. So one thing that also differentiates is that with our treatment packages, with complex cases, we have a money back guarantee. We believe that it's not right to ask you to pay money if you're not getting results. So in the first 2 to 4 sessions or the first 2 weeks, if you feel that you're not getting better or you don't like our treatment approach, we give you a full refund, no questions asked. So we're the only clinic in Orlando that actually offers a money back guarantee on our treatments. So this is a perfect example here with Raul. He failed multiple treatment approaches for his sciatica pain, and we were able to get him in, solve the root cause, and kind of customize the treatment approach based off of his type of sciatica and what is causing his sciatica symptoms. And then from there, he got results, and he was able to get back to live his life and get pain free and to get the results that he actually wanted without needing surgeries, injections, and all sorts of chronic medication. So what are the 3 steps that you need to learn to get pain-free? And we broke this down into 3 main phases. And this is what you have to understand. This could be applied to any type of injury, but this video is specifically for sciatica. So phase 1 is you have to solve the root cause of your sciatica. What is causing it? There's many causes. It could be a herniated disc. It could be stenosis. It could be a facet problem. It could be an SI joint problem. It could be piriformis syndrome. It could be neural tension. Those are pretty much the 6 to 7 main causes of sciatica. Sciatica is a symptom, but you have to solve the root cause of your pain. In phase 1, you should also be able to clearly know in 2 weeks whether treatments are working or not. This is what we tell patients this. It's like, listen, if you're doing this treatment, you'll know in 2 weeks whether treatment's working. You'll know whether your pain's going down or whether you're seeing progress or not. There's no need to wait 6 or 8 weeks to see if like something's working. If we've done our job right and we've solved the root cause and we customize the treatment just for that, you'll see in 2 weeks whether things are going down. So you should see a reduction in pain in phase 1. And on some cases, we shoot for a 50% reduction in pain in a matter of 2 to 3 weeks. This is not a strength thing right now. This is where you only do light strengthening. And we make sure that you're not getting flare-ups. And the main goal of this phase is to get pain down and to solve the root cause. So the key point of phase 1 is you must solve the root cause of your pain. For example, if you really have a herniated disc problem, but you're getting treated for a SI joint problem, you could see that you're missing the root cause because I'm treating the SI joint, which is in the pelvis, when your root cause is in the back with a herniated disc. You have to solve the root cause of your pain. That's how you get results. So phase 2, you move on, you continue to get a decrease in pain, but the key thing is that you increase mobility. Mobility is more like joint range of motion, back range of motion, hip flexibility, and like stuff like that. So you should start to see a decrease in pain even more and an increase in mobility. You should see this relationship happening now. And this is where you start some of the basic strengthening. And if we solve the root cause and identify these underlying risk factors or impairments, you shouldn't be getting flare-ups. Okay, so The important thing with phase 2 is that there is a decrease in pain, a further decrease in pain, and an increase in mobility. Okay. In phase 3, which is more of the final phase here, this is where you'll reach the ultimate goal of getting symptom-free or pain-free. You're going to maximize your mobility and flexibility. You're going to increase your strength even more. Yes, there is a strength component involved in this. That will get you the long-term outcome. So things don't like come back. You have to regain that strength to prevent flare-ups and prevent this from coming back. So this is the main strength component here, where you'll make advanced strengthening progressions, get into functional strengthening, and this is where you start returning to sport, whether it's running or tennis or golfing, whatever you want to get back to. This is where you kind of get back to the return to sport programs, return to exercise, return to whatever you want to get back to doing. So the key point with this is that this is where you're going to start getting advanced strengthening, and this is where you'll return to your activity without pain, without flare-ups, and you get your life back, and you end up getting the result that you actually wanted. So this is a great case study where Terry actually went in to get surgery done for her sciatica symptoms. She got a fusion done at L5S1. She came out with the same sciatica symptoms. So the root cause was not coming from L5S1. So she got a surgery. She came to see me after this. This was an interesting case. We solved the root cause of her pain. We got rid of the sciatica symptoms, and now she's back doing her activities of what she wants to do. Another case here, Julie. She was diagnosed with a herniated disc. She went to go see, I think, 3 different physicians. They all wanted to do surgery on her, but she didn't want to get surgery. She came to see us, even though she had a herniated disc. We were able to treat her, get her pain-free, get her sciatica centralized, and get her pain gone. And she was able to get back to being pain-free and back to her run walks and exercising without ever needing surgery. So like a very important step is solve the root cause and get a customized treatment approach that is going to get you results. So the first step in order to get pain-free, if you're ready to take action, is to do the pursuit evaluation. This is where you solve the root cause of your pain and you get a customized treatment approach. So what does the pursuit eval entail? So what we do here is different than most. Our evals are 60-minute evaluation with a board certified specialist. So you're going to see the expert who specializes in sciatica every time. You're not going to get passed to the second person or an assistant or a tech or anything. You'll see the board certified specialist every time. Our number one goal during the eval is to solve the root cause of your pain. Make sure that we identify risk factors and underlying impairments of why your pain's not going away. Once you solve the root cause of your pain, then you can customize your treatment approach to make sure that you treat that specific root cause. So you're going to learn exactly what is the best and most effective way to treat your pain. You're going to get a specific timeline on when you should expect results, by 2 weeks this, by 3 weeks this, by 4 weeks this. You'll know exactly what's coming and what to expect. You'll get a customized treatment approach, and you'll also get a recovery phase outline. So you'll know exactly, am I in phase 1, phase 2, or phase 3, and what you should actually expect. We do offer a little bit different stuff than, it's time to take advantage of technology. So you actually get 24/7 unlimited messaging access to your doctor of physical therapy. I hate it when you have a question to ask the specialist or the doctor and like there's no way to get in touch with them, or you have to send an email and you have to wait weeks to get results, or you have to send a message to the assistant, to the nurse, and then finally get to the doctor. This way you can send us a simple text from your phone, and you have unlimited amount of 24/7 email or text access to your specialist. So we really pride ourselves in effective communication. If you're running late too, you can just shoot us a text. It's time to take advantage of technology and make things easy. If you need to move or change your appointment, you can just shoot us a text to the front desk or to our concierge specialist or even to your treating therapist. So we have flexible and convenient scheduling, and we don't have waiting times. That's the worst thing about healthcare. When you're scheduled for a 12 o'clock appointment and you're sitting in the waiting room forever, and then they bring you back to your room and you're waiting for another hour, and you don't see the specialist until like 1:30, if you're scheduled for an 11 o'clock appointment, you will be seen at 11 o'clock. So we do not have waiting times. Bonuses, with the eval, you get treatment. There's no sense in us telling you what's wrong but not doing anything about it. If you walk in with sciatica and walk out with sciatica, I mean, you have sciatica. We do like to do treatment on day one. There's no sense in telling you what's wrong but not doing anything about it. You're also going to get a customized video-based home program. Again, it's time to take advantage of technology to make sure that you are watching the videos. You don't have to memorize anything, and you can get started on a day one to complement treatment and get things started. You also get any mobility equipment needed. You can get like balls, loops, foam rolls, and stuff like that. And we also have a money back guarantee with our packages too. So again, we believe that it's not right to ask you to pay money for services if you're not getting results. So we do all of this. Our evaluations here cost only $165. So you get all of that stuff that I just mentioned for that. And we can get you in for an eval. Our specialist will make sure that you're taken care of. They'll solve the root cause of your pain, make sure all of your questions are answered, and we'll customize a treatment approach. And then you can decide on what's best after that. So if you're ready to get started and to take the first step, you can give us a call or text today at 407-494-8835. If you have other questions about our sciatica treatment approach, you can keep on scrolling down, looking at other testimonials, looking at our treatment approach, and see what other patients have said about their experience and their results with sciatica. So thank you for tuning in, and I hope to hear from you soon.